So Daniel, last time we talked, you told me you were visiting psychiatrists for some of the alcohol concerns that we've been talking about in our sessions. How did that go? Okay. So he diagnosed you with an alcohol use disorder, severe. Okay. You're making a face that seems like you don't necessarily agree with that. Well, we can talk about it. So, an alcohol use disorder is a substance use disorder specifically for alcohol. Some of the criteria is spending significant time trying to attain the substance, so trying to get alcohol, or using the substance. And I know in the past we talked about how you would go on binges, and you might even miss work due to using alcohol. Some other criteria is persistent desire or unsuccessful attempts to stop the use of alcohol. And I know previous treatment that you've had where that was unsuccessful in stopping that alcohol use. Another criteria is continued substance use has led to impairment in your life. And I know you're currently in couples counseling due to the strain that alcohol use has caused for you. There's increased tolerance, so needing more alcohol to get that desired effect. And you told me about that progression that you had from drinking beers to drinking hard liquor, from drinking just at night to drinking in the morning throughout the day. There's also the cravings. So cravings is a criteria, so that once you stop using, you still desire. Your body craves that alcohol, and I know that we've kind of talked about some of those urges that you've had. And alcohol use disorder is a common disorder. Um, Around 7% of the population above 12 actually struggles with some sort of alcohol dependency. Okay, so you're not alone, and whether you agree with the diagnosis, what are some of the drugs that the doctor prescribed you? Antabuse, okay, and you're not really sure what that was for. So antabuse is used to treat alcohol use. Antabuse is also known as disilofram, which is its generic name, and antabuse is the brand name. Antabuse was actually the first drug used to treat alcoholism. So there's a lot of research done on it and its effectiveness. Um, how it works is antabuse is an alcohol antagonist. It works by blocking the enzyme needed for metabolizing ethanol. And as a result, if you drink on it, you'll get some pretty nasty physiological responses. In layman terms, um, antabuse doesn't allow your body to metabolize alcohol. So if you drink on it, then you'll get sick. And I actually have a video here to kind of give you a better example of what's going on with that.
Antabuse is a drug also known as disulfiram, and it is a medication that is taken to prevent the clearance of alcohol as it's broken down in your body after drinking. It is much more a behavioral intervention as it is a pill that you take. By allowing yourself to take that on a daily basis, because it is a pill that you have to take every day, it will prevent the patient from drinking, due to the fact that if they drink while taking it, they will have such a reaction because of the alcohol elements built up in their blood as it goes through their body, that they will have nausea, vomiting, high blood pressure, palpitations, and are quite sick for quite some time. So it's a behavioral intervention as well as a pill that you take to prevent the drinking to continue.
So something I want to mention from that video, actually, Daniel, is that he keeps saying that it's a behavioral intervention. And the reason why, and the next question was, does alcoholism or does antabuse cure alcoholism, is it's designed to stop you from drinking. It's another barrier. It's a protective factor against drinking. It doesn't cure alcoholism. You're still gonna desire to drink. There's still gonna be urges, but it's gonna be something that motivates you to not drink. So, it's still going to be important for you to attend meetings. It's still going to be important for you to speak with your sponsor weekly, like you do, and it's still going to be important for us to do the therapeutic work that we do here regarding your alcoholism. So, just because you've been prescribed this medication doesn't mean that everything else goes out the window. Okay, so. I know he mentioned side effects and we kind of ran through them quickly. So if you want, we can talk about it. Okay, good. So some of the common side effects are skin rash, acne, headache, feeling tired, loss of sexual interest. And it's important that um, if any of these side effects are causing significant impairment in your life, not to just stop taking it, but to speak with your psychiatrist. So the loss of sexual interest, if that's causing more harm than the anti-abuse is doing good, then you can troubleshoot with your psychiatrist on alternatives, because there are alternatives like Vivitrol that can help with alcohol use. If anything more severe than some of the side effects I mentioned, skin rash, acne, headache, feeling tired, anything more severe is occurring, then it's important for you to contact your psychiatrist, okay? Or go to the emergency room. Mm. And I know he mentioned that you'll get sick uh, while drinking on it. And so generally, like he kind of said, the nausea, the vomiting, there's sweating, there's thirst, and some chest pain. But it's also important to know that in severe cases, there's heart failure, there's unconsciousness, there's convulsions, and there's even death. Okay, so it's very, very important that you don't drink while on anti-abuse. Okay, and that if you do drink, um, you're being safe, and that you contact the emergency room immediately. Okay, and you contact your psychiatrist to find alternative methods, because it's not safe to drink while on anti-abuse. and and that kind of leads me into a point that I wanted to get at, is that a significant challenge when it comes to prescribing anti-abuse is non-compliance. People stop taking it because they say it makes them feel sick, when in reality the drug is there to make you stop using the drug that actually makes you sick, which is alcohol. So if drinking while on anti-abuse makes you sick, then the solution shouldn't be to stop taking anti-abuse. It should be to stop drinking. So I just want you to keep that in mind. What the motivation is to to not um, to not drink alcohol. Okay. And so risk. I know we talked about stopping taking anti-abuse. So risk. The main risk to stopping taking anti-abuse is just relapse, which has already caused you so much strain. So it shouldn't be taken lightly. Okay. And some of the benefits of that of anti-abuse, along with the the sickness that you get, some of the protective measures, is that it prevents you from drinking, from going on a binge like you used to. So when you feel sick, you might get sick, you might get nauseous, but hopefully that nauseousness stops you from drinking the next day and the next day and the next day. Hopefully, it helps you to recover and say, okay, let me call my sponsor and things like that. Okay. Um, I know you mentioned being kind of scared to take medication because you're not good at tracking it, and sometimes you overtake your medication. Anti-abuse doesn't really doesn't have any reported signs of overdose, so you should be safe there. Obviously, you want to take your medication as prescribed, but again, there's no reported cases of anti-abuse overdose. The the main uh, the main risk is drinking while on anti-abuse. Okay, so I'm glad you actually got prescribed this. This is another layer of protection. Again, we still need to do the work um, in our sessions, in the meetings, to get you on a long road of recovery. Okay.